You are now live. Have a good meeting.
Thanks.
You
Good
guys
morning.
are now live.
Okay, thank you. So good morning. I am Jen Teague, and I'd like to welcome you to the June 24th, 2022 Homelessness Initiative Advisory Committee meeting. Quickly, Sarah Copley is usually the person who is facilitating this meeting. She's unfortunately unable to be with us today, so I'm helping to facilitate. All committee members and staff are participating virtually. We appreciate your patience as we work through committee meetings a bit differently. We are streaming live on our Virtual Engagement Hub, which is accessible through the Virtual Engagement Hub link on the front page of the city website and also linked on the committee page. We also have an option for the public to listen and comment live by phone. To do so, please dial 855-925-2801 and use meeting code 9836 to listen in. For those of you out there with us today, welcome. We're going to do a quick roll call. I'll go through and introduce all the committee members who are participating virtually. Please make sure to mute your microphone if you are not speaking. When you have a question or would like to speak, unmute your microphone and then mute again once you are done speaking. Committee members, as I call your name, please say a quick hello. Multiple screens to navigate. Thank you for your patience. David Bartholomew.
Good morning, I'm here.
Sarah Copley. Lance Crawford.
Good morning.
Jason Desai.
Good morning.
Elvia Diaz.
Present.
Tim McEllier.
Present and accounted for.
David Nash.
Present and unaccounted for.
Joel Steininger. And we have a new recently appointed Jessica Supik, who is not able to be with us today, and myself. Okay. The next thing on the agenda would be the consent agenda. Do I have a motion to approve the consent agenda?
I'm sorry, Jen, backing up just a sec. I think we skipped Jason.
Skip Jason.
Me? I think we did say my name, but I'm here. Thank you.
Sorry about that. And yes, please feel free. If I miss any pieces, please let me know and make sure to address that. Okay, so the consent agenda. Do I have a motion to approve the consent agenda?
So moved. This is David.
Thank you, David. And a second?
Second, this is Jason.
Okay, great. And now we'll do a roll call again to approve the consent agenda. David Bartholomew?
Yes.
And just a quick point, if the person was not here in the roll call, can I skip over their name during this section for the roll call vote?
I think so.
Okay, great. I'm going to take that as a yes. Lance Crawford?
Yes.
Jason Desai?
Yes.
Elvia Diaz?
Present.
And Elvia, this is for the consent agenda?
Yes.
Thank you. Tim McEllier?
Yes.
David Nash?
Yes.
Joel Steininger? I can't remember if he was on the call. And Jennifer Teague, yes. Okay, staff updates.
Great. Good morning. Thank you all for being here. It's good to see all of you, and special thanks to Jen for just rolling with punches and jumping on in and leading the charge this morning. I just have 3 updates to share with you. The first is about federal funding. I'm sure that a lot of you saw the announcement from HUD 2 days ago that a special notice of funding opportunity has been announced that is specific to unsheltered homelessness and rural homelessness. There will be a lot more detail to come on this, but I just wanted to give you sort of high-level overview that our continuum of care will be eligible for up to $820,000 over 3 years. that funding opportunity can support permanent housing, so both permanent supportive housing and rapid rehousing, supportive services, which can include street outreach and HMIS. And this will follow the typical continuum of care application process. So again, much more to come for this committee as we move forward, and particularly for the finance work group. That the submission to HUD is due October 20th of this year. So we'll be working through that in the coming months. The second pot of funding is ESG, Emergency Solutions Grant, which I know you're all familiar with. I believe we talked about this last month, but just wanted to update you that we're expecting the RFA next month. The ESG office of the state has shared that that will be coming out in July. So similar process that I just described for that special continuum of care funding will also be due in October. We'll also heavily involve the finance work group. We're going to really put those guys to work. So again, more to come on that, but that's our second pot of funding. And then the regular annual continuum of care competition will be coming sometime. So we don't have a clear timeline on that yet, but do expect it soon. Second update for me is about the permanent supportive housing project at the Ramada. I believe we talked last month about the closing having been delayed related to the need to get an environmental assessment approved by HUD before they could move forward. That approval did come in 2 days ago. So that project is on track and will be able to close in the next few weeks. So that's a good big step that happened this week. And I don't have the exact closing date at this point, but we should have that in the next couple of weeks. And then lastly, just wanted to share that I am hoping that we'll be able to add 2 positions to our team over the coming months. I'm very excited about this. So currently HR is working to fill Brian's position. So we've had 2 positions on our team that are focused on homelessness. We have asked for a 3rd team member in the new budget year. So we will know a final decision about that next week. And then, as you know, the city is part of the National Opioid Settlement. So we are receiving about $1.5 million in opioid settlement funds. And related to that, we were invited by Dogwood to apply for a planning grant that they made available to local governments that are receiving those settlement funds. And that grant was for up to $300,000 per year for 2 years. So we applied for funding for a staff position for 2 years to manage that planning process. The settlement funds are really specific in what you can and can't support with those dollars. And so the staff position would manage that strategic planning process, would work very closely with Buncombe County staff, and would also bring that behavioral health expertise to our team. So we have been awarded that grant by Dogwood, and so I am excited about that. Certainly my own experience is much more connected to housing and homeless programs, not necessarily behavioral health. And so I'm looking forward to the opportunity to have that as part of our team. So it will be some months before any of those positions are filled, but just wanted to let you know that we will be looking to have a team of 4 over the coming months. And that's it for me. I'm happy to answer any questions.
Thank you, Emily, for those updates. So we do have 2 additional individuals with us on our call today, and we're very excited to have an opportunity to hear from them. So we have Christy and Josh with the National Alliance to End Homelessness. As you all know from Emily's past staff updates, they were the selected consultant for the work that's happening here in partnership with Buncombe County, City of Asheville, and Dogwood Health Trust. So I'm going to turn it over to them to tell us a little bit about the project and the work that they'll be doing over the next couple of months. Thanks for being with us.
Thanks, Jen. Hi, everyone. Good morning. I have met some of you, had the pleasure to meet some of you when Josh and I were in town a few weeks ago. I'm sorry for others that we missed, but we will be following up with you all, as well as we'll be back in town again in August. So as Jen said, my name is Christy Schulenberg. I'm the director for the Center for Capacity Building here at the National Alliance. And my colleague Josh is with us. He'll introduce himself in just a second. I think Josh is going to share his screen because we have a little bit of a PowerPoint that was available to folks. Josh, are you sharing your screen? I'm not sure. I can't tell on Google Meets. I'm not too savvy on the Google Meets. There it is.
Showing, let's see.
Oh, there's Josh and I, or me and Josh, Josh and me. Okay, great, awesome. Okay, so I'm just going to start off first by saying that we're calling this the Understanding and Responding to the Crisis of Unsheltered Homelessness Project for Asheville. And we just wanted to take a minute to share with you a little bit about what we plan to do for this meeting and meetings moving forward. So yeah, great, thanks, Josh. So first, I just want to say that we want to just share with you what we want to do over the course of these meetings. I think we're going to be with you every month to give updates until the end of this project. And so part of that is obviously because you are the governing body of the continuum of care in Asheville, Buncombe County's continuum of care. So we understand that we're going to bring to you, one, a needs assessment regarding how, what the characteristics, trends, and overall needs are of your community with regard to unsheltered homelessness specifically, but homelessness in general. We'll be bringing those, that needs assessment report. It's going to be a written report, and we'll present that to you likely sometime in September. And then we'll come back in December, and we will, probably maybe January, sorry, and share with you recommendations based on those needs. And it's our understanding that you as a governing body will have an opportunity to ask questions, challenge assumptions, talk through everything that we present to you. And ultimately, when the recommendations come through, you will vote on those recommendations to recommend them up to the governing bodies behind this project, which I understand are the City of Asheville, Buncombe County, and Dogwood Health Trust. So that's the process in terms of our understanding of your role in this. And so because of that, we want to take the opportunity when we're with you each month to give you an update. It won't be the only place we give you updates. We'll be giving updates on the county website also every month. But we also want to take that time not to just give you updates, but to continuously give you context and kind of level setting as to how we're even approaching the needs assessment and the recommendations ultimately, so that you understand the context of which, how we understand evidence and data and research related to homelessness, solid policies related to homelessness, best practices related to how homeless systems work within communities across the country. Because we don't want to give you these, the needs assessment and recommendations without guidance, or not guidance, context and opportunities to kind of ask questions along the way. So I just wanted to share with you a little bit about how we like to approach those meetings moving forward. And I think for the general public, who I hope more and more folks come to these meetings, they also can kind of journey with us along the way as to how we're approaching and working on this project. So I'll just kind of jump in. Josh, next slide. So a little bit about the National Alliance to End Homelessness and the Center for Capacity Building. So we are a national 501c3 organization. We are headquartered in Washington, D.C. And I like to think of us as kind of like a three-legged stool. We do advocate for federal and state policy to ensure that the very dollars that Emily just shared with you that are coming into your communities continue to come into your communities and in fact increase over the years. So we have a policy team that works very closely with administration staff, federal agencies, and congressional delegations to ensure that that money continues to meet the need, the growing need of homelessness in the country. And then we had our Homelessness Research Institute, which is a lot of research on evidence-based practices and policies as it relates to effectively reducing and ending homelessness. And then we have the Center for Capacity Building, which is the team that Josh and I are on, where we bring that solid policy and research to the practices to communities. So kind of each of those three-legged stool, we inform each other. And so that's what we are bringing to your community and other communities across the country. Next slide. So this is us. Again, I'm Christy. I identify as white. My pronouns are she and her. And I'm going to give Josh a second here to introduce himself.
All right, thanks, Christy. And the Google Meets thing is acting a little wonky, so I can't see anybody anymore. But I'm assuming you're there and you can hear me. But I'm Josh Johnson. I am the Senior Technical Assistant Specialist on the Capacity Building Team. I go by he, him, his pronouns and identify as Black, African American. And it's great to be here with you all today.
Thanks, Josh. And our contact information is there, and we obviously welcome you all to reach out to us, as well as anybody who's watching live. Next slide. So I'm just going to give a little brief overview of the project, which I've kind of started to do already, and kind of where we're going. So the immediate deliverable is this phase 1, which is this comprehensive needs assessment. So we are conducting a qualitative system and program level analysis. We are deep in the midst of that right now. We've sat down or spoken over the Zoom with many of you to get a sense of who you are and what you do while we were in town a few weeks ago. And then we are now diving deeper into that. So we are meeting with a number of stakeholders, homeless service providers, law enforcement, the Public Housing Authority, foundations, people who are currently experiencing homelessness, people who recently experienced homelessness, system leadership, community paramedics, is a whole list. And we will put that list up on the project website update and let you know kind of where we're at in those conversations. So we are doing a deeper dive into understanding the work that you and many of the folks that I just spoke of are doing. And we, as well as collecting a lot of information about policies and procedures and program design and job descriptions, just to kind of get a sense of like what are we saying on paper is how your homeless system works, and then speaking to people to kind of find out what might actually be happening in practice and how those particular things line up. We are going to be back in town the week of August 15th to do focus groups. We will also provide a list of focus groups that we're doing. Many of them involve stakeholders who I just expressed, as well as, for example, the Chamber of Commerce and the neighborhood associations and the faith community. So we are trying to gather as much information as we can and to listen as to what's working and what's not working in the community to end unsheltered homelessness in particular, but homelessness in general. We're also doing a quantitative system and program level analysis. So we're taking all of the available data we can get. Much of it is, some of it's public information like the point in time count or the housing inventory chart that helps us understand utilization. And then we are pulling information or data, from your homeless management information system. And we are also asking programs that don't currently enter data into the homeless management system. We are asking them and providing them some tools to also provide us data. But that will be up to them as to whether or not they want to provide that. But we will definitely have access to the homeless management information system. And we're looking at that to understand performance, like metrics like how long are people experiencing homelessness in your community? How many people enter into a homelessness program and exit to permanent housing? How many people enter into a homeless program and then exit to homelessness? Do people enter into homeless permanent housing and then 12 months from now return? So we're looking at just kind of how the system is working to make homelessness rare, brief, and one time. In addition, we are looking at the race and ethnicity data to understand disparities within your system, which I think you all already know there are some disparities in your system. So just looking at how your system serves people equitably and how that can be improved. So we'll take all that information and we'll develop a written report, and then we will come back it says August, but we ended up starting contracting a little later, so it's likely going to be September. And then we will move on to a recommendations report, which is the second phase, where we look at what the needs are and then identify multiple interventions or strategies to offer the community that we think would appropriately respond to whatever those needs are. And we'll be looking at other communities that are similarly situated to Asheville, and also that have interventions that we think will help you all improve that performance. And we will deliver that. It says December, but it's likely you probably don't want us to present to you the week before Christmas. So we're probably going to move that into January. So that's where we're at in terms of the approaches. So we'll be working with you until early next year. Next slide. I think that might be okay. So I'm going to hand it over to Josh because we want to spend a few minutes, like I said, level setting and providing you a lens in which to understand how we're approaching this project. And one of the places, the very first foundational place we do that is to look at how well does the system within your community work to respond to homelessness. So Josh is going to walk through kind of what we mean by that. Josh?
Yeah, thank you, Christy. Can you guys see me? I can't see anybody. Can you just say yes?
I can see a nice blue background with our logo on it, but you're there, I'm sure. There you are.
Okay, cool. All right, thank you. Well, yeah, so like Christy said, just do a quick level set of when we're talking about an effective system, right? So we want to make sure that we're clear in what we mean by that. So I'm going to go through some slides just to really talk about what an efficient, an effective, equitable system looks like. A system that is efficient and runs smoothly. It really aims to house people as quickly as possible, right? And then also when safe and when possible, there's a lot of attention to diverting and preventing homelessness. So we're moving people out of homelessness quickly and then putting mechanisms in place to divert whenever possible. Communities who do this effectively, they have an intense focus on housing people as quickly as possible, right? And there is that coordinated effort at the front door of the system to have those type of diversion conversations to really examine other potential options. So we want to use a equitable systemic approach that's cross sector in nature, right? What we want to make sure that each of the resources are all targeted and aligning with coordinating towards ending homelessness, right? So we want to ensure that is a community goal. All the different sectors and providers within the system all are working towards the common goal of housing people or preventing homelessness whenever possible. So we always say that a homeless system should be functioning with the end goal in mind. And what is that end goal? The end goal is to make homelessness rare, brief, and one time. So your system should align with some of these following. Your system should all be working to get towards some of these following bullets that I'm going to talk through a little bit. Your system should be working to ensure that people who are in a housing crisis have access to immediate assistance in a safe place to go. Right? You want to ensure that your system is working at whatever as much as possible to ensure that people are not unsheltered. Right? We want to ensure that we're moving people into housing quickly, so people are not spending long times periods experiencing homelessness within your community, and people are not exiting homelessness and going right back, right? So the interventions that we're providing, the connections that we're making are allowing folks to stabilize their housing crisis even after they move on from the system. So we want to do this by really looking at our system performance measures, right? So when we look at our system performance measure, are we reducing the inflow into homelessness? Are we want to ensure we're increasing exits to permanent housing, decreasing average length of time in homelessness, and decreasing returns to homelessness, right? So as a system, we want to establish these performance measures to effectively measure what we're doing. How are we doing this? This is what HMIS, the Homeless Management Information System, will tell us this information as far as how long folks are experiencing homelessness, how often they're coming back, and this is where you want to start with trying to improve these numbers to really get to that end game that we talked about in the last slide. So in order to really to effectively do this cross system, we have to have some belief and some standardized practices that are that should be across all interventions, all programs, all sectors that are involved within the system. So that includes that we always encourage equity at its foundation, right? So we want to ensure that everyone who enters the homeless system or is at risk of homelessness is served effectively, served with dignity, and there isn't any disparity in who has access to services. That also looks like who's leading some of the conversation are folks who are marginalized or in the community a part of the foundation of coming up with the solution. Is housing first, right? Is that thread throughout the whole system, right? Is that something that people believe in? Do people understand what that is? But our people are actively understanding that housing is a human right, and we're not putting barriers in front of folks to access some type of housing. We want to ensure diversion is throughout the system, diversion and also problem-solving conversation throughout the entire system, right? So diversion is really about when folks are at imminent risk of homelessness, and we're having those conversations around what are some alternative options for outside of entering the homeless system or entering homelessness. We want to ensure that throughout the system, there's a rapid identification and engagement of people experiencing unsheltered homeless, right? So we should have a coordinated effort to identify and engage folks who are unsheltered in our community. And again, that should be across all systems, right? That should be a thread throughout our homeless system. We want to ensure our programs are quick and accessible. There's not high barriers to entering to shelter or other programs. And then we're really focusing on short stays in our program whenever possible, right? We're trying to get folks out of homelessness as quickly as possible, as we talked about a couple slides ago. We also want to ensure that we're having an intense focus on rapid connection to permanent housing, and that's for unsheltered and sheltered folks. Christy, I wanted to give you an opportunity to add anything as I jump through these slides.
No, that's it. I'll chime in. We're gonna have time for questions at the end, so I'll participate then. But this is good. We're just this kind of like 50,000 foot overview of this is a system.
Yep. So thank you, Christy. So and usually we'll spend a decent amount more time on these slides, but I'm trying to be respectful of your time, and make sure we have time to really to have some conversation as well. So a system flow, really, if you think about it, it really should work like a roundabout, right? People enter in, but people exit out, right? So a lot of times in our systems, and each of these cars kind of represent. Think about these cars representing programs. If one of these cars doesn't effectively move out of the roundabout into out of that roundabout, then what happens is you'll see more of a traffic jam, right? You'll see the flow of people entering, exiting is being obstructed, right? So then you'll see maybe increases in unsheltered homelessness. You'll see wait lists for shelter. You'll see all these different things that really look at that really demonstrate having a poor system flow. And a lot of times when we make decisions based off of what our system needs, it's not necessarily based off of the system flow itself, but it's more or less based off of what the problem is, right? So for instance, if we have poor system flow, for instance, and I'll give an example. If a community doesn't have if the rapid housing isn't effectively moving people quickly and out of unsheltered or sheltered homelessness, you might see a huge log of folks in shelter or who are unsheltered. So a community might say, well, we need to build more shelter, we need to do more outreach, we need to do more stuff that's geared towards the folks who are unsheltered, instead of really looking at the system flow and saying, what's the best vehicle to move folks quickly out of homelessness? So would that investment be rapid housing, or should we invest into, again, like adding it, like for keeping it with an example of this roundabout, should I just create a whole nother street that connects to this when I really just need to work on the flow of the roundabout? So it's just more or less thinking about that. I guess Christy said that 500 feet view of like the system and how each piece of the system is vital in order for it to flow. And if one or two pieces aren't moving correctly, then it can bottleneck the system. So here's just some examples of what a system a system that has poor flow could look like. You might see an unchanged, increased number of unsheltered folks, wait lists for shelter, length of stays in shelter being longer than 30 days. High percentage of folks who are homeless returning from shelters returning to homelessness. Average length of homelessness is not decreasing, inflow homeless is steady or increasing, right? So that's that really giving up that diversion piece. Long wait list for the RRH and PSH, or may not use the rapid rehousing and permanent supportive housing. Our issues are a law within the coordinated entry list, right? And then also there's a significant amount of people aren't getting any kind of assistance. So again, that's just I think we just wanted to give a baseline of what we mean when we say, a homeless system response. That's what we talk about when we say a homeless response system that's moving, effective, efficient, and equitably. So I want to take a minute to ask you all, think to yourself, right? Do I know what our homeless and housing program inventory includes? Do I know how people enter the system to receive services? What happens after people enter the system, and how do they move through it? How do people exit the system? Where do they go? And how do we measure our success in making homelessness rare, brief, and one time? And I'm just going to give you a minute to just reflect on that. And as you're reflecting, if there's questions that you don't know the answer to, right, then that's, that'll continue to be a part of our conversation. It's something maybe to flesh out as you continue in your work. All right, so we're not gonna ask for that feedback as of yet, but I want you to think about this. When we make decisions on how resources are used in the community without thinking about the system flow. Remember when I talked about, making the decision to build more shelter or build more outreach or build whatever the case may be, because we have, for the example of unsheltered, you might end up with something like this, right? You might have a lot of different programs, but there's no coordination, right? So you're putting a lot of different pieces that are based off of the immediate need, but not necessarily based off the need of the system in order to move people in and out of home, move people either away from homelessness or out of homelessness as quickly as possible. So again, this is kind of what happens when you don't think about the system, when you're making, system decisions. And so this is just a quick snapshot of what, a homeless response system typically looks like, right? There's a coordinated entry assessment. Folks are triaged. They go, if needed, they go to emergency shelter. If they can be, there's homeless prevention utilized, diversion. So from homeless prevention and diversion, once they try to access an access point or the front door of the system, they can go right back into the housing stabilization. That could be with family and friends. That could be their own housing. Then, or if they need emergency shelter, they might get referred to emergency shelter where there's some type of assessment that's done that might link them to rapid rehousing, that might link them to transitional housing, and then hopefully quickly they move from that program to stable housing. Now there are folks individuals who are very high need, who go through that coordinated entry, that prioritization, who need permanent supportive housing, right? As we know, there's not those are the folks in the community with the highest need, and then we refer from coordinated entry or that prioritization. They could be in emergency shelter, they could be unsheltered, but they have touched the homeless response system and got some type of assessment done that, and then getting them linked. I think you all call it your CAM meetings, right, where they prioritize for the resources. One of the important things is don't assess for interventions until available, right? And why we say that is if we're continuously I'll give an example. I worked in a community that folks were continuously getting these assessments like every couple of weeks, every month. And so at one point, this person had like 20 assessments done, but there was no permanent supportive housing available, or there was no rapid rehousing available. So there was just this continual assessment process. So at this point, are we just assessing to assess? Are we assessing because we know that there's an actual potential intervention that is available? So that's just something to keep in mind that we always just highlight. So when we're thinking about our system, we think about the flow, and just think about the system in Asheville. Does the flow represent something like this? Is it on that continuum of stages to someone needing homelessness, diversion prevention, someone getting referred somewhere, someone getting or if they're unsheltered, they're getting triage through the prioritization, and then getting linked to the appropriate programs and or housing opportunities. All right, we pass it back to Christy.
Great. We're just going to wrap up and let you know what the next steps are. But I just kind of want to summarize or emphasize some things that Josh said. Having an understanding of the flow in the system or where the bottlenecks are for you as a governing board is critical. For the very reason that Emily shared in the updates, you have 3 incredible, almost unprecedented funding opportunities in front of you, not to mention the unprecedented funding that's come through in the past with the CARES Act and ARPA and things like that. But the unsheltered NOFA, the special NOFA that dropped yesterday is an incredible opportunity. It's money for new projects. And so as you look at, or as you create your scoring projects, as you create the comprehensive plan, because you will have to have a comprehensive plan as a part of that NOFO. It is different than the regular NOFO. So thinking through what your comprehensive plan is going to be, including the partners, the key partners that have to be a part of that comprehensive plan in order for you to increase your competitive edge within the competition, is critical for you as a governing board. So as you go to approve your project rank and review documents and scoring tools, thinking about projects and how they are going to help increase your flow is critical. Same with your ESG funding opportunity that's coming up, and even the planning grant for the opioid settlement, which I'm not very familiar about, but thinking about what kind of supportive services, or how can that planning, that strategic thinking about the use of that money, how can it help you create flow in your system by serving people who are highly vulnerable? So just, I guess, for you as your role, thinking through the importance of using these funding opportunities to increase flow in your system, to identify people and move them quickly out. So this kind of comes as a good time. I mean, these funding opportunities are going to be happening. You're going to have to respond to them way before you get any recommendations from us, though you will have the needs assessment. But having written a few consolidated applications for large communities, I know that your time in the next till the end of this year is going to be pretty focused on that. So just I can't emphasize enough that the opportunities are being presented to you right now in a way to create that flow. Next slide, Josh. Okay, so as I said, we're continuing to meet with folks, interviewing, collecting documents, collecting data. We are going to put out probably five surveys that will be posted on the project update website, as well as will be disseminated among all the stakeholders that we're working with, and they will include surveys for system leadership. And these are surveys to understand your opinions, people's opinions about what is working and what's not working in their understanding of homelessness within your community and the potential interventions for them. So we're looking for leadership within the community, and I mean that very broad, like executive and senior leadership of federal agencies, of nonprofit organizations, of advocacy organizations that are touch and likely serve a lot of the same people experiencing homelessness. Then we're going to have a more of a provider survey, which is like for staff of these organizations, from case managers, supervisors to intake, to folks who are doing intake. And then we're going to have a survey for people currently experiencing homelessness and people with recent lived experience in homelessness. And we'll be working with a lot of key stakeholders who are in relationship with those folks to get their feedback, because obviously we're not just going to stick the link up and assume everybody who's currently experiencing homelessness has access to that. So we'll be surveying folks. We do want to encourage you. I think you all are in a process of recruiting open seats for the HIAC, and just want to stress, like, as you understand maybe a little bit more about what we are looking for in terms of an effective system, thinking about who are those partners who are not at the table. My advice would be to look at that NOFO, that special NOFO came up, because there's some really good guidance in there about who should be at the table. So highly encourage you to recruit individuals who are currently experiencing homelessness, have recent lived experience homelessness, and actually represent people who are homeless. So in your community, I think a quarter, the data shows a quarter of the individuals experiencing homelessness are Black or African American. Our recommendation is that a governing body should reflect that reality. So just thinking, who are our partners that need to be here that are not at the table? Like I said, we're back in town on August 15th. We're going to update that monthly project page. We're working with Emily on that. We'll be with you every month to get on your agenda. We will graciously take any time you will give us. And I will leave it at that and leave time. I think we maybe have about 10 minutes for questions. I have to leave at 10, but Josh is gonna stay with y'all. So yeah, just opening the floor to any questions you might have.
Thank you so much, Christy and Josh, for that presentation. And yeah, definitely want to open the floor to anyone who has any questions. David, go ahead.
This may be it's partially a question, partially a comment. I think when you were talking about assessing only when resources are available or openings are available, and it's been a while since I've been participant directly in coordinated entry, but as I recall, the assessments we were using a few years ago were quite complicated and quite lengthy, and it would be very impractical to assess 200 people using that kind of assessment when we have one opening. So I guess, and I think, it's the BIs for that we've talked about in the past, which of course does have an adverse, it is a structurally racist tool, and doesn't distribute people in a racially equitable way into available resources. So my thought is, or question, I guess, is should we keep the assessment as simple as possible, looking primarily at things like length of time homeless, with maybe a couple of other categories to keep those assessments simple.
Well, I'll go ahead and answer that. So yesterday I spent the afternoon with the CAM work group, and to be able to ask questions about how coordinated entry and the assessment tool works within the community. It was very helpful. And I think it's important, and that those questions were around the 4 components of coordinated entry, and so I want to speak to the assessment part. We looked at how are people accessing the system, so that's the first element of coordinated entry. How do people even figure out like where to go when they're having a housing crisis? Is that equitable? Is it clear? Is what happens at every one of those access points kind of standardized in terms of experience? Might be different for population served, and that certainly should be accounted for, but there should be some standardization around that. Then the assessment, you are using the VIs for that. We did not talk much about the tool itself for the very reasons that you raised, David, about many communities are moving away from the VI SPDAT. There are some good questions on the VI SPDAT, but inherently, it's, as an overall tool, there is a need to move away. Plus, Ian and ORCode are not supporting it anymore. So the assessment, I think there is a lot to be said about the tool itself and the way the community is using the tool to assess, or just the assessment process. We're getting a better understanding of that and how it is evaluated, whether or not it's standardized, what is the experience that people are having when they're assessed. And there are definitely, I think from our conversation yesterday, there are some needs that were identified there. But I want to separate out the assessment to the third element of coordinated entry, which is prioritization. And oftentimes the assessment and prioritization get really super conflated. In this community, you use the VI SPDAT and length of time homeless on paper and in practice. I mean, this is just what I gathered a little bit from yesterday. But then there's a process of like kind of case conferencing for slating and placing people into programs. And I need to understand more about what that is. There seem like there might be some challenges, some not best practices in there, but it's definitely some things to leverage. But I think that folks just need to be clear about like separating the assessment as one part of the coordinated entry process, and then what happens with the assessment and other factors to prioritize people for resources. You don't have many resources, right? Going back to like the simpler, the better, definitely the less traumatic. What is the information what is the least amount of information you need to understand a person's housing crisis, get the information that they need, and kind of phase them into the system. Like one of the things that AHOPE said yesterday was they have a problem-solving conversation, the diversion conversation, just trying to get a sense of like what's happening here with this person, what are their needs. They actually wait a couple of weeks before they actually do the assessment to kind of see if that diversion, that kind of case management, like do people kind of self-resolve? What happens to them? And so that phased approach we've seen is a little bit more of a best practice. Like, do we even need to assess all these people? Maybe a problem-solving conversation would help many folks, but of course in your community, you have an increasing number of unsheltered people with much higher and more vulnerability, more acuity. So that may not work for everybody. But to answer your question, less is better up front, less traumatic as well, to identify what the pathway needs to be. I mean, that's like right now, in terms of referral to resources that you don't even have, we're just kind of beginning to understand and kind of try to tackle that. But that is a reality. How do you balance this idea of scarcity with housing justice, right? So it is trying to figure out how do you serve people with the resources that you have now while trying to increase that and scale up interventions that will more adequately meet that need. So I think we know that your system, there are some needs around coordinated entry. It's not equitable. It's slightly, it seems like it's not standardized. It's not evaluated, and it's unclear, how people, whether people are equitably getting connected to those resources. So those are just some early things. That's just from the conversation yesterday. But there's also, I do want to say, there's also lots to leverage. You have a smaller community, and that case conferencing piece is a good piece in your system. How decisions are made regarding those placements, I think there's some needs there, but the case conferencing, I think, is an opportunity for some real coordination and partnership. So that's a real plus. Sorry, David, that's probably more than you wanted to know.
No, that's helpful, Christy. Thank you. I think, I'm going to be advocating for as simple as possible. I think we need to determine whether people are candidates for rapid rehousing or permanent supportive housing, or maybe some other intervention. And we need to look primarily at length of time homeless. We want the people who have been on the street the longest or in shelter the longest to move forward into homelessness until we get it down to a rapid response system. And I think, complicated systems are inherently or tend to be racist in their results, and we need to get away from that.
Yeah. Thanks, David, for the question.
Yeah, I just want to add really one thing. Is I think what it's really getting at is just going away from communities who their next step after engagement is just this BS for that or whatever the assessment is, just this blanket, as you said, like David, 200 assessments, right? And then you have this log of all these assessments, and the conversation is about this assessment is going to get you to housing, but knowing that there's one rapid housing placement that's might be available in the next 2 or 3 weeks, right? So what is that doing with that engagement? Where could that conversation have gone with the outreach or case manager? How could we could be working on a whole another housing plan using that time to really be more client centered and less just continuously throwing these assessments out, knowing that they're not really going anywhere. But that is a great question.
Thanks, David. Any additional questions or comments? Well, I definitely think for the first time it's a lot to take in, but as Christy and Josh said, they do plan to be with us each month. And so I think it'll give all of us an opportunity to reflect on what we've heard today and also kind of continue to think about what additional questions may come up for us in the next time that we meet.
I just want to add real quickly that we have that project page that Christy referenced under development, and that'll be on the city's website soon. I hope next week. And as soon as we have that finalized, I'll send that out to you all.
Thanks so much, Jen. Thanks, everybody. It's nice to meet you, and we will be in touch with all the HIAC members to get to talk to you a little bit more about what your thoughts are.
Thank you. And I just want to say thank you so much to the National Alliance to End Homelessness for applying for the opportunity to be a consultant for this work. And I think we're going to continue to learn a lot from the expertise that you all bring. So we look forward to continuing to meet with you each month.
Well, thank you. We're hoping, we're not hoping, we know we'll learn a lot from you too, that we get to take to other communities. So that's great.
Great. Well, we'll move on to the next item on our agenda, which is work groups. And actually, Christy kind of got us started when talking about nominating committee. So we do still have some open seats. I'm going to give the quick update about the nominating work group, and then I'll turn it over to Emily to give the updates on the other two work groups that we have. So the nominating work group has been meeting. Just as a reminder, that's myself, Emily, Sarah, and Jason. And unfortunately and fortunately for Jason, he has put in his resignation with this committee. He will only be with us through, this is his last meeting, and he will be moving on. So we are seeking someone on the nominating work group in addition. So if there's anybody on this committee right now or that is interested in serving on that work group, we would love to have you join us. We are meeting about once a month. We may end up meeting less than that in the coming months once we get all of the positions filled. But as you all know, we did have a lot of open seats. The committee met last week, and we made a couple of recommendations to Buncombe County. They have not been appointed yet. Those individuals have not been appointed yet. But we did make one recommendation for the appointment to the city seat, and that was Jessica Supik, who we mentioned at the beginning has been appointed. We have had, in addition to Jason's resignation, which will be effective as the end of this month, Angel has also resigned. And so we do have his seat available as well that we will need to look to fill. And that position or that open seat has been posted on the city website, is my understanding. Correct, Emily? And I think with applications closing on August 5th.
July 5th.
Oh, July 5th. I'm sorry. Thank you for the clarity. So if there's anyone out there in the community that's listening and you want to apply, we would love to have you submit your information. You do that by completing the applications that are on the county website and the City of Asheville website. The nominating committee was reviewing. And as Christy mentioned, there are certain areas of that are noted in applications for funding, and we're really trying to make sure that we have representatives from those areas on this committee. So yes, Councilwoman Roney.
Just a matter of clarification, perhaps staff can look into this for us, but I know that our boards and commissions committee for July has been canceled and we're meeting once in August. So I wonder if we might have an extended timeline to do outreach for these openings.
Yes, I can follow up on that. My understanding from Sarah and Jerry is that the opening is posted until July 5th, but that appointments would not be made until August. And I would expect that it would be reposted immediately if we didn't have, you know, the pool of folks that we needed by that July 5th deadline.
Thank you, Emily.
Thank you for that clarification. And so if anybody has any questions or you just want to learn more about HIAC too, you can reach out to Emily or myself, and I'm the nominating work group committee lead. So feel free to reach out to us. We're happy to share with you a little bit more about the expectations of HIAC, and then look forward to receiving additional applications for our open seats. And any questions about the nominating work group? Again, if anyone's on this committee is interested in serving on that committee, we would love to have you. Let us know. Emily, I'll turn it over to you for Code Purple and Finance.
Great. Not much of an update on the Code Purple work group. That group has not yet met, so it has been formed. Sarah has been leading that, and they had some last minute scheduling challenges with the scheduled meeting for this past month, and so we'll be looking to reschedule that. Excuse me. And the finance work group, we have successfully recruited 3 HIAC members to participate in the finance work group. So that will be David Nash, David Bartholomew, and Lance Crawford. And we'll also be looking to add to that group with some folks from the community. The finance work group will meet for the first time this coming week. And we'll just mostly, my intention with that meeting is that we'll mostly be looking at process and just getting organized for these 3 big funding applications coming our way. So again, more to come on that, but we do have that work group formed and do have a first meeting scheduled for that group.
Thanks, Emily. Any questions for Emily? Okay. Next thing on the agenda is coordinated entry membership, and that's Emily.
So just a process reminder, our policy is that when organizations are interested in becoming part of our coordinated entry system, which is related to everything that Christy and Josh were just talking about, the process for that is that they submit a request in writing to city staff. We work with the coordinated entry work group on that request to discuss what that would look like and whether or not that makes sense for our system. That work group then makes a recommendation to you all for final approval. So we have a recommendation from that group for your vote today. So Eleanor Health Foundation has asked to join the coordinated entry system. They are a newer organization in our community, so you may not be that familiar with them, but the folks involved there are certainly familiar to you. So Amy Upham is the executive director there. I'm sure a number of people on this call know Amy from her work at the county, and prior to that with VIA. Their mission is expanding equitable access to addiction recovery, and part of their work is providing emergency assistance to help people access recovery supports. So currently, about 20% of their population served are people who are literally homeless, so certainly a lot of connectivity with the folks in our homeless service system. And they also, of course, have recognized that housing is such a critical need for the people that they're connecting with, and because of that, have applied for 3 housing grants that are currently pending. So they're really looking to expand their footprint into doing some housing work. So they have requested to join the coordinated entry system, you know, in kind of 2 directions. One is certainly to refer their program participants for housing interventions in our community that already exist. And then with a view towards integrating their own housing interventions into that system as they're able to expand those services down the road. So again, they have made that request. The coordinated entry work group has approved them to join the coordinated entry system. So it's moving that request forward to you all in keeping with our policy for final approval. So we are asking for a vote on that action item.
So we would need a motion. Any discussion prior to a motion? Any questions? Okay. Is anyone willing or interested in making a motion?
I have a question.
Okay, go ahead, Elvia.
So this is strictly addiction recovery, which goes along with the same kind of sort of what we were doing with the Ramada. It kind of sounds all the same. We're dealing with behavioral health issues, yet we're lumping kind of everything into addiction. And so BioHealth deals with not just addiction recovery. We are not confronting a behavioral health component that exists within each of us. So I have questions regarding how this is termed and deemed, and who it's going to be helping, because I'm viewing it as a bias and how we approach behavioral health issues. Because a behavioral health issue, even when dealing with somebody who is a healthcare professional, comes with sometimes with a pill. And so, which creates other health issues. So when we talk about addiction recovery, we're talking about the same things with these grants that are coming up, because we have what was it, $300,000 coming from somebody who from an opiate epidemic. So let's take a second and assess how we approach behavioral health care before we just start throwing things in the term addiction recovery, because there's a lot of addiction recovery that comes without a pill. There's confronting, there's conversation, there's talk, there's all kinds of support. So I want to make sure that addiction recovery is not just addiction recovery because there are no personal supports, there's no encouragement, there has to be other components that go along with this. And I know that BioHealth covers them. I think that we can all use training within that before we start looking at what is the word addiction.
Absolutely. So let me say a few things. I can say a bit more about Eleanor Health Foundation, but we'll certainly say, like, I'm not the expert on the services that they provide. So just to be clear, Eleanor Health Foundation is a nonprofit organization. They're not connected to VIA. They're not part of VIA's services in the community. And their specific focus is around access to addiction recovery. And part of what that means is they have a scholarship program where they help people access funding to support entry into treatment programs, or halfway houses to help. They provide some rental assistance to people. And the folks that they're working with may be in recovery right now, or may not, may not yet be in a place where they're in recovery, may be actively using. So really kind of a broad range, but really looking at social determinants of health as it relates to people who are currently using or are in recovery right now.
I also want to point out that when people experience homelessness, in order to fit in order to survive on the outside, they have to start using sometimes. There's a lot of things that go on with being homeless that you don't or wouldn't normally do until you're homeless. So just considering those things as well. And I'm not being discriminatory because somebody has an addiction. That is not my point of contention here. My point of contention is that I would like to have something that is inclusive of people who just have a behavioral issue or an issue dealing with psychosis or something that they're innate or is innate to them.
Yeah, absolutely. Their particular request for you all to vote on is to join the coordinated entry system. And my goal is that we have really widespread participation in that coordinated entry system, so that we have all of our partners at the table who are representing services across the community, exactly like what you're describing. Because, we know that that as is true for every single human being, like there is no one size fits all response to the things that any of us are experiencing. And so it's really important that we do this together as a community and that we have all of those folks at the table. So this is Eleanor Health Foundation looking to have a seat at the table, but certainly it is our role as me as staff and you all as committee to continue to expand that table and expand the service providers who are participating in that.
Yes.
Thank you, Elvia, though, for your comments. David?
I'm sorry, I had to step away for a minute, but can somebody repeat what action we need to vote on for this particular item?
This is Eleanor Health Foundation requesting to join the coordinated entry system and having funneled that request through the coordinated entry work group who has approved that. So moving it forward to you all for a vote.
So I'll move to approve that.
And a second?
I'll second this, Tim.
Thanks, Tim. Any more discussion before we move to a roll call vote? I think that's the right process. Okay, so I'll do the roll call. David Bartholomew,
Yes.
Lance Crawford,
Yes.
Jason Desai,
Yes.
Elvia Diaz,
Yes.
Tim McElroy,
Yes.
David Nash,
Yes.
and Jennifer Teague, yes. Okay, motion passes. Thank you. Thank you, Emily, for that update and for the conversation. And I think that's a great point that Elvia made and that Emily then said kind of our role is to continue to bring additional providers in and to bring and to be aware of what areas we don't have represented either here or in coordinated entry too. And so that brings us to public comment. Christina, do we have any public comment?
Hi. Yes, we did receive 2 written public comments during the meeting. Would you all like this read aloud or would you like this shared via document? Did you guys hear me? Hello? Can you
Yes,
hear
I'm
me?
just not sure how to answer the question. I'm
okay.
sorry.
No, you're fine. I'm just glad you can hear me. It's whichever you prefer. We can upload this on the city's webpage and then share that all out with you all, or, we can do whatever works best for the committee.
I'm fine to have it read aloud here. I see Emily's shaking her head. A couple of people. Yes, I think it's fine to go ahead and read it. Thank you.
No problem. Yes, so we received a comment from Darren Smith, and it reads, I recently moved to Asheville, and this is my first time attending one of these meetings. It's great to hear about the plans you all have to address the homelessness crisis in Asheville, and particularly the opportunity for more permanent supportive housing. Did I read correctly that there is an opening for a member on your committee? What qualifications are you looking for? And that concludes that comment. Then also we received another comment from Jamie Binshoff, and it reads, do staff at hotels, homeless shelters like Rescue Missions and Salvation Army, Homeward Bound, A Hope, Sunrise, like helping homeless get housed, ? Addressing burnout? And that concludes that comment as well. And that is all the public comments that we have received.
Thank you, Christina.
Of course, you're welcome.
Any additional comments before we move to the last item on our agenda, which would be adjournment? Okay. Well, our next meeting is scheduled for July 29th. Appreciate everyone being with us today. Oh, yes, Councilwoman Roney.
Out of curiosity, when if someone were to make a public comment at a meeting like this one about how to become a member of the meeting, of the group, what does follow-up look like so that the person making the public comment would know the process?
I'm looking at Jen, and I imagine Jen's looking at me, but I'm happy to follow up with her. I'm looking at Jen only because she's the nominating work group chair. I am happy to follow up on the process information about participating in HIAC.
Thank you. So the staff liaison could be the outreach to the person making the public comment. And then how would we get information on how to follow up with that person? Since this person provided a written, I imagine there's an email that is associated. I see Christina's hand up.
Hi, Councilwoman Rooney. So I believe that I can address that. There is a bit of information that is shared on public input that helps us to be able to reach out individually to, our citizens that actually reach out and leave public comments. So there are ways that we can do that. And then also I would like to add that whenever we do receive any sort of public comment, the first thing that usually happens is we share that with our staff liaison so that we can formulate a way to, reach back out to that individual that left that public comment and to, act as quickly as possible.
Thank you so much.
You're welcome.
Those are excellent clarifying questions and comments. And also for the community at large, there are additional information you can find additional information about the appointments, both from the county and the city on Buncombe County's website and the city of Asheville's website, along with the applications. But thank you so much. And it sounds like Emily will do some follow-up as well. Elvia, I see your hand is up.
I was going to actually just make a comment that I thought that we, in this particular meeting, I don't know if Darren is participating, and he said this was his first meeting, and when he had posed his question, but we had talked about needing new members and gave information concerning that. And I had wondered if that had satisfied what he was asking. That was it.
Yes, thank you. And I think it's always great for us to continue to put that forward kind of at the beginning of the meeting, middle, and at the end. We do want continued community involvement. So thank you to all that were listening in today. If there's no additional comment, I will now adjourn the meeting unless there are any objections. Okay, so adjourned. Thank you all. Have a wonderful rest of your day and weekend. Bye-bye.